Sponsored by the NHI. You're listening to Begging the Question.
Good evening, everyone, and welcome to Begging the Question. Tonight's guest is Dr. Johann Serfontein. He's a healthcare professional and external lecturer at Stellenbosch University. And tonight he's going to talk to both Siv and myself on the topic of immigration. Welcome, Johann. And can you tell us why exactly you want to leave South Africa?
Look, it's probably something that's been floating around my head for a while. And, I think if one looks at the current situation and what's happening at the Zondo Commission, I think that does explain a rather large portion of why one would want to consider leaving South Africa at this stage. And I mean, it's not an easy decision to make. You are leaving a lot of people behind in the end, inevitably. But, I don't think that at this stage, South Africa has a positive outlook. It just doesn't appear like the policy trajectory is going to change suddenly into something that becomes positive for us in the long run. And therefore, I started looking at getting my ducks in a row to get out of the country. And, it might seem a bit pessimistic, but, I think if you ask somebody from Zimbabwe in 1985 whether they thought Zimbabwe would be in a good place in 20 years, they probably would have said, they think it would, and yet in 2005, Zimbabwe was in deep trouble, and I kind of think that at this stage, I don't feel particularly positive about where South Africa is going. And I think that kind of prompted the move a little bit to something where you've got a lot more certainty in where the country's going. It's got a positive future and, policy certainty, very stable and those kind of things. So, I thought all of that is quite important, and that's not things one to getting in South Africa at the moment.
See, another thing that I've also heard from other people and also other influential YouTubers and so on and so forth was that the majority of people immigrating from one country, whether it's the USA, South Africa, or Zimbabwe, or wherever, is because they're not getting the treatment that they feel they deserve from that specific country. And they become what I would call capitalist or free market nomads, right? They move where the base taxations of the individual or companies are for them, and they, invest in those countries. If the country's policies start to change, then they start looking for another place to move towards. Is that more or less in line with what you see also happening in South Africa? People are rather looking at countries that actually want to take care of the individual on the tax level and also on policy level.
Yeah, look, I don't know necessarily whether a lot of people are leaving at the moment strictly for financial reasons. I think there's a lot of socio-economic reasons besides finances, which is prodding people to go. Personally, I mean, I'm going to be earning less in New Zealand than I'm earning locally here, but there's quite a bit of a difference in what you need to spend your money on, because you don't need to pay for private healthcare, you don't need to pay for private security. You don't need to send your kids to private schools or any of those kind of things. So for me, the choice was never really a financial one. It was one of a question of, government finances, I guess, do play a little bit of a role. If you look at ours at the moment, the government is spending exorbitant amounts of money on civil servants who are not really doing all that much. And, and then now we're also looking at a basic income grant. And the fact that a basic income grant is required, I think that's what's the big concerning thing, because the economy is not growing, you're not creating jobs, and we're busy turning into a bit of a welfare state, and that is not, although New Zealand itself is also a bit of a socialist country, you find that, it's got a 4.5% unemployment rate even now after COVID. And, and yet, so you've got a lot of taxpayers and then you get free services as a result of that. And it's services you can use. This side, one really doesn't want to use the government healthcare system. The police are dodgy at best. So So those are the kind of things, but there are people that immigrate for financial reasons as well, and they normally end up, in places like Portugal and those kind of places. But not a lot of people move to New Zealand for financial reasons. It is a fairly expensive country to live in. A lot of equality there from an income point of view, so you're unlikely to be earning a whole big chunk of money. You'll probably be earning in line with more or less everybody else. So that's definitely not the main motivation for this. But there are other places where people with really big money end up going, and Cyprus is usually one of those. You can get a European passport in Cyprus if you invest 2 million euros there. So if people have a lot of money, that's normally what they do. Or you can go to Portugal, you can invest €500,000 in property there, and you get citizenship as well eventually. So so there's definitely other kind of places where people with financial interests in leaving goes. New Zealand's not really one of those.
Okay, so from what I can understand then is, in regards to New Zealand, would you then say that New Zealand government, specifically the New Zealand government, do you think that they are more transparent with the way of their finances than, let's say, South Africa is?
Oh, definitely. I think, the fact that corruption and those kind of things are clamped down immediately. There's no half measures when it comes to dealing with corruption. I know towards the end of last year, there was one of the cabinet members that had an affair with somebody, and he was forced to resign by his party. Now, I mean, that's, in our world, that's a relatively minor transgression, but over there it's a big deal for them, because they can't be seen to have people with questionable moral character sitting in parliament. So the guy was kicked out basically for something which we on this side, it happens every day, and it's in parliament, and it's just kind of like a minor deal. So definitely, they have a zero tolerance policy for those kind of things, and I think that's very important, because if you clamp down on the small things, it stops the big things from happening. And of course, their justice system is very, very functional. So if they do pick up on anything, people go to jail quite quickly. So, it's not like here where you've got 15 years since the arms deal process started, and some people are still walking around without any questions asked, really, So I think, that's the difference in their approach, is that, they don't tolerate these things at any level, and over here it's almost, it's almost part and parcel of the package, that if you're deployed to a position, it's almost expected that you need to then have a patronage network that you serve in that position.
Yeah. So any questions from your side?
I think on the subject of New Zealand, and I don't want to get bogged down in a COVID discussion, but they've got the sort of the fiscal accountability, but I would say their handling of lockdown has become, I don't know, a bit dystopian in some senses, where they only had, 1 or 2 cases locked down the entire country, and, Jacinda Ardern's messages of how you will be, if you don't want to be tested, you'll be locked up and stuff. So in obviously in the general terms of better opportunities, I understand the move, but I'm wondering, does that sort of authoritarian streak give you pause for thought at all?
Look, I'm kind of a person that generally I don't have a problem with authority. So, I've always been like that. So, something like that doesn't really concern me too much. I tend to kind of stick to the rules in general. So, it's not something that I would find extremely strange or anything like that. I know the locals in New Zealand are a little bit unhappy about some of the latest lockdowns that there were now, but in general, the management of the whole situation has been quite good. And of course, personally, I'm not going to end up in Auckland. So normally what happens there is also that the cases end up coming in through Auckland usually, and then Auckland gets the brunt of the lockdown. So I'm going to be in Palmerston North, which is about an hour and a half north of Wellington. And the rest of the country is normally on sort of a level 1, perhaps a level 2, when Auckland, kind of goes up to level 3 or so, and that starts really impacting what you can do and things like that. So, for me, I'm not too concerned about that. At least they have a plan. They've already procured enough vaccines to vaccinate the entire country's population. They've already started. They've only got 5 million people there. So it's not as big a task as we've got going here. But they've got a proper formal plan. They've started with the border workers over there, vaccination wise, which makes perfect sense because they're the people that are exposed over there. Everybody sort of outside of the border facing situation, there's no COVID in the rest of the country. So it makes it very easy to see who to start with. And by the look of things, they'll start rolling out to the rest of the population by about July. And the other thing is that they had the luxury of sitting back a little bit to see which vaccines look like they're the most effective, and the safest. So they didn't have to rush to buy whatever they could find. And from the look of things, the current vaccine that the AstraZeneca one, seems to be picking up some problems in Europe now, and that was what we would have had, and perhaps it was a blessing in disguise that it wasn't effective against the South African strain, because it seems like the very healthcare workers that the health system depends on would have been the first people to be vaccinated with a vaccine that turns out to perhaps not be quite as safe as everybody thought. So yes, but for me personally, I don't have a problem with the authoritarian approach as much. At least it's a reasonable authoritarian approach. It's not like over here where cigarettes and booze are banned, and one has to really question why that happened, because it just created this massive black market for these things. It seems like it's reasonable and logical what's happening there, and I think that's for me also appealing. Because governments that just make rules for the sake of it, the whole closing the beach, but you can walk on the boardwalk, and the closing of parks, but everybody can go walk around in the mall. Some of those things are really quite questionable. Because you would be a lot safer if you were walking around in a park than you are in a mall, and yet the park is closed and the mall is open. So, so those kind of things just rationally don't make a lot of sense.
So, from what I can understand, then, is your move is basically not economical, but more or less to do with government efficiency and competence. Have I got that right?
Yeah, that I think is definitely a big part of it. I think I want to go to a system that works, a system that looks after its citizens. And over here, you've got a very, very small tax base. It's got to pay for everything. And basically, the majority of taxpayers don't really get much for their taxes. Besides your taxes, you still need to pay for private security, private schooling, private healthcare. And, so one starts to question, why are you paying all these taxes if you still have to pay for all of these other things also, and over there, you pay your taxes and you get things for it. You get proper free schooling, you get proper free healthcare. The police do a wonderful job, and they've got quite a large kind of police to citizen ratio as well. So they've got a lot of police persons. They're not generally even armed, but they're there. So that's the kind of civilization I personally want to live in. Where police don't shoot innocent bystanders when they're walking out of the doctor's office. Those kind of things is what won't be happening there. And for me, that sounds like the kind of place where I think I would fit in.
I'm still trying to swallow the reasonable authoritarian part. It's I don't know how I can consolidate the two aspects, because as you probably know, Siv and I are very individualistic, and we look at absolute freedoms for the individual versus that of the government. And where these two seem to clash, we always take the part of the individual, or at least we try to, as far as reasonably possible. And when I hear, for example, reasonable authoritarianism, I go, ooh, I don't know. That's a bit of I'll chew on that, but maybe you can probably give us some examples of reasonable authoritarianism, if you want to call it that.
Look, I think it's a personal choice as well, So for me, I'm probably, and that's why, I think I had some disagreements with people during the regional lockdown as well, is that they were very focused on civil liberties, and being able to move around and things. And with a medical background, I could see what the point was of the original lockdown in the sense of trying to prep the healthcare system and those kind of things. So it made sense to me. So initially, for instance, that would have probably been a fairly reasonable authoritarianism on a local point of view was the original start of the lockdown, when there was a bit of a plan of getting the healthcare system prepared and those kind of things. So initially that was good, obviously it went pear-shaped from there because the healthcare system wasn't actually ever prepared after that. And, it was still, it's still not. So yes,
Still
but
waiting.
we're still waiting for the healthcare system to prep. Perhaps by wave 15, we'll get to a point where the healthcare system can cope with it. But, so in New Zealand, I feel like, if you look at things like, the traffic laws, for instance, they've got a point system going on their driver's license cards, So if you start getting traffic fines, eventually you lose your license as a result of that, So they implement that, and they implement it effectively because it's not a situation of a policeman trying to fine you so that they can elicit a bribe from you. They fine you because they feel it's their duty, and they really want to get you to learn from the experience almost. Over here you get fined because it's almost like people are trying to elicit bribes out of you. That's what it seems like. So those kind of things, the kind of highway speeds there, it's 100 kilometers an hour. So it's not like it's 120. And if you look at the annual road deaths there, you find that they've probably got about 90 people a year that die on the roads, So compared to what we've got going on here in over here locally, we always hear about the road deaths during April and during December, when everybody's traveling on vacations, and then they speak about 1,200 people a month dying in those 2 months. What they don't tell you is that every other month in South Africa, 1,200 people die on the roads anyway. Mm-hmm. So if you take into consideration how many more people are on the roads in April and December, then it's actually not doing too badly. But so those kind of things. So they've got 100 kilometer an hour speed limit. So yes, it takes you forever to get anywhere when you're traveling on the long roads, but it creates a bit of a safer environment, and over here, even though taxis have got 100 kilometer an hour limit, they simply don't keep with it. They go as fast as they can until things start falling apart, and that's the speed they go at. Literally. So over there also, when they've got things like Easter long weekend, they've got the police out in force, and they, if in those periods, if you do 1 kilometer over the speed limit, they'll fine you because they see the roads as being busy, and they see proper enforcement of the speed limit as a way to protect the people. And so for me, those are kind of reasonable type of things. Over here, I don't see a lot of that happening. One only has to look at all these ridiculous lockdown regulations that were brought up to realize that there's nothing logical about what's always happening here. And the fact is that it almost looks like people that don't pay their TV licenses almost get harsher sentences than people that are involved in spousal abuse or things like that. So we've got a very, very strange way of applying the law in South Africa, and for me, I generally try and keep within the law, and so for me that kind of that very harsh authoritarian approach doesn't really bother me as much. But perhaps it's a personal thing. Perhaps New Zealand won't work for you. So if you ever want to leave, perhaps New Zealand's not the option. And I think Australia is even worse. I think a lot of people say Australia is a very, very bad nanny state. And yeah, that is definitely the case over there. They've got some interesting things that they tend to apply. But for me, New Zealand, it seems like it seems like a good fit for me from sort of my cultural perspective about how I feel about individual liberty versus what law abidance and things like that. So for me, it's a personal choice. Perhaps for you, it might not quite work as well.
Yeah. See, this is where it gets interesting. Yeah, Seth?
Yeah, well, I think for I think for us, I think it's not really a case of strict laws. I think the thing that bothered us with the lockdown was the fluidity of laws. So it's fine. It's fine if you know that the speed limit is 100 kilometers an hour. I think the problem that Dodgy and I had most of all was that on a Sunday night, the speed limit would go to 80, and the next Sunday it would go to 140.
Yes. And that was the biggest stripe.
Yeah, but I also just wanted to point it out. I think maybe a key takeaway for me from that section was that SA's incompetence did us a favor with the vaccines, and New Zealand's authoritarianism did them a favor in terms of the vaccines. I think that was a fair and interesting point.
Yeah, no, look, it definitely is. And, I think what one has to realize, for instance, when it comes to vaccines in South Africa, is that 34% of our population are under 18. Now, the current vaccines can't be administered to people under 18, so that means that if one wants to get to herd immunity in South Africa, you have to vaccinate 100% of the rest of the population to do that. So, that's a big ask, I mean, you've got to basically vaccinate everybody, and you've got to do it in a short enough time that it actually matters. And that's not to say that the children that you don't vaccinate can't actually, transmit the disease, So it doesn't help if you've got the adult population under control and children are not necessarily, so that they can be carriers, especially your teenagers and things. So it becomes problematic to see at which point South Africa is going to reach herd immunity, if one has to rely on vaccines. And I'm concerned that eventually one will get to a situation where you would have to get your vaccine every 6 months from the corner pharmacy, especially if you want to travel overseas and they start making vaccine passports a requirement for traveling, then one hopes that you will have the option of going to the corner pharmacy and getting a vaccine. But if you've got to rely on the government, it seems that you may not get your vaccine. And, then it might mean that you're not able to travel either internationally. So, for me, it's very concerning is that it doesn't appear that we've got a nice cohesive plan about how are we going to implement. And even now with healthcare workers, and I mean, there's a lot of people doing a lot of hard work behind the scenes on getting vaccines in here and getting them distributed. But, the private sector guys that are involved in that can only do so much. And then you've got to rely on the government who's busy purchasing the vaccines. So, there are concerns with that, and it's going very slowly. And the question is, how do you effectively ramp it up to get it to everyone in the country? If you're already struggling a little bit just now with the healthcare professionals themselves that need to be vaccinated. So I'm a bit concerned about the aspect of trying to reach herd immunity in South Africa. And I think, it also, one doesn't quite know how long are the vaccines going to make you immune, which means that, if I heard yesterday some anecdotal evidence of pharmacists that tested people for antibodies after they tested positive, and so they did weekly tests on them to see how long they could pick up antibodies. And 3 months later, they couldn't pick up antibodies on the tests anymore. Now, that's a bit of a concern, because does that mean that you're no longer immune to the virus? And then, of course, with all these new strains developing, one could be vaccinating people, and halfway through there's a new strain that develops that even the ones that are vaccinated are not necessarily immune against. So there's a lot of questions, and that's why you need to have a approach where you can get a large enough portion of the population vaccinated in a short enough time. And that is what South Africa doesn't seem to be able to manage it, or going to be managing anytime soon, especially looking at the availability of vaccines, and now also the availability of the actual syringes that you need to use to vaccinate with, because everybody was focusing on the vaccines, and now suddenly we've got a syringe shortage. So it's just interesting how these things crop up.
Drink it. Just drink the vaccine. That's my only advice. Don't take my advice as medical advice, guys. I'm not a medical practitioner. I'm not a medical professional or anything like that. I'm just a guy with a high school diploma. So But
Yeah, well, you could powderize it and drop it off at nightclubs in four ways, and most
oh
of
god,
Joburg would be
oh,
would be
oh
vaccinated by the end of
no.
Friday night.
I think perhaps the African potato needs to make a comeback, you know.
Or the
Oh
Madagascar drink.
Yeah,
yeah,
that one, yes.
yes.
Yeah.
But you see, we're coming back to a government system that seems to work. And for some people, like you pointed out, it's not necessarily financial, and it's not necessarily, in the case of Civ and myself, where we might find ourselves with maximal individual freedoms. It might also be because of security reasons. And that's something that I've also noticed a lot with people moving, especially to Australia and New Zealand. I've got friends and family that moved over there specifically for the as we would call them, the nanny states, right? Because they seem to be capable of giving security to these people, a sense of security, I would say, because in a pandemic, honestly, eventually, like you pointed out, you'll have to try and get to a herd immunity, and there's only so much that a government can do. The rest should be up to the individual. Yeah, the other point that I want to raise is it also seems like there's some sort of general agreement between the individuals in New Zealand and probably in Australia to some extent for the greater good, right? They seem to understand why their rights would be limited. In South Africa, because of the fluidity, there are problems with accepting that, which then can cause later down the line a lot more problems than it can give solutions. Is that basically more or less correct, my
Yeah,
assessment of that?
yeah. I think starting with the security issue, I think all of us realize at this stage that we've got a major crime problem in South Africa, and I think that the fact that a lot of additional people have lost their jobs during lockdown is only going to add to the crime problem, unfortunately, because you've got just so many more people that are struggling to make an income and starting to look at what else they can do, whatever that may be, to earn a living, And that's the kind of thing, unfortunately, crime pays in South Africa. It doesn't necessarily pay a lot, but the victims, it costs them a lot, because people will be killed for a cell phone or something like that. It just seems like the value of human life is a bit skewed in South Africa. People will get killed for the, smallest thing, So that, I think, is the big concern. And that is something that is totally outside of one's control. I mean, I can try and make my house as safe as it can be, with extra measures and things. But if you're going around the corner, you don't have control of what happens at the traffic light, So that I think is a big concern. And yes, in New Zealand and Australia, you have a lot less of that. I think I've got a friend that moved over in December, and in December they went to watch a cricket test in Christchurch. And when they got home, they saw that they actually forgot their garage door open, and yet everything was in the garage, So I mean, if you leave your garage door open here, well, you out of your house for 5 hours, you will probably lose everything and have a family of squatters living in there when you come back. So for me, that is definitely a big aspect. And the second one is on the freedoms. Definitely New Zealand has quite a big approach of, they speak of the team of 5 million, and they really have a lot of cohesion in trying to eradicate the virus. And I think, because they're a smaller population also than we are, it's a little bit easier to do, and being an island, of course. So that definitely helps, because you've got a lot fewer ports of entry and things like that. In our case, we've got the entire Zimbabwe border fence that is just like a sieve, and everybody is just leaking in there to look for a better life in South Africa. And I think, in the whole lockdown concept is very difficult to do in South Africa because, such a large portion of the population live in squalid conditions. They've got a lot of people have single room shacks or small single room houses, RDP houses. One cannot realistically expect somebody to sit in a place like that for any extended period of time and expect them to be happy with it. So, and the moment you've got one part of the population that starts saying, listen, this lockdown nonsense doesn't work for me, and everybody starts walking around outside, the other part of the population says, well, if they can do it, why can't we do it? And then you've got a general breakdown of the whole thing. And of course, I think that you still have a issue that, sort of something like the taxi industry, had way too much power in the way that they dealt with government, and the way that, sort of how many people they can have in a taxi and things like that. And I mean, taxis turn out into super spreaders. Because if you drive past any taxi, you'll see people are wearing masks in there, but almost none of them have them across their noses and things like that. So you might as well not wear a mask then. You're in an enclosed space. It was in the winter as well, so everybody's windows were closed because it's just too blooming cold to have the windows open like you're supposed to. So you create these little miniature breeding grounds for the virus and little super spreader events, and then you've got somebody getting in and somebody getting out, so you've got a nice flux in the population as well. So, those kind of things contribute quite a lot to spreading the virus, and then especially in the Black communities that end up using the taxis quite a lot. That you've got this big, these little super spreaders that transport them everywhere. And I think you and me that have got our own cars, we're relatively, you're relatively able to control your circumstances. But when you're in those circumstances, you've got absolutely no control. And it makes it very difficult. So, we in South Africa, I think we've only got a real sensation of cohesiveness when the Rugby World Cup final is on and we're playing in it. Then everybody will kind of cheer together at that point. But the rest of the time, unfortunately, we're quite a diverse population. And I think we're in a situation where people don't really care for each other all that much. And it's a problem, and I get the idea in New Zealand, there's a real sense of community, people look after each other. In South Africa, it's difficult, because some people are really in bad shape, and, the people that can help, can only help so much. So you can't help everybody, unfortunately. And that's, creates a bit of a problem. And I mean, you only had to look at what's happening at the traffic lights of late. I mean, every traffic light's got a couple of people standing there begging. So that's definitely getting worse. And ultimately, with a lot of the private sector jobs, people taking pay cuts, people losing their jobs, you find that people don't have they might still be compassionate, but they simply don't have the means to help other people out anymore like they did before. So that's got an effect on the population as well. But yeah, I think it was a difficult time for everybody, and I think practically, having a lockdown in a poor suburb in South Africa is really very, very dangerous to do. And I think it's quite surprising that our death rates are as low as they are. And I think, anecdotally, things like the TB vaccine that people get when they're young, the BCG vaccine, that might well have helped us all. They did some research in Germany that shows that the people that were in East Germany back in the day, they still got the BCG vaccine, and they did a lot better than the ones in West Germany. So, so perhaps there's these kind of things that did help us along. But for people that are in really bad financial shape, to not really see as big an effect of the virus in their community by people passing away or people getting really sick, makes them wonder why do they need to bother to social distance? Why do they need to bother with staying in their house? Because of that absence of a sense of community, I think, and that is something that's definitely in New Zealand quite a big thing.
The other thing that I've noticed is that we've applied a blanket sort of lockdown, right? Never mind the ludicrous laws like the banning of alcohol and cigarettes because of a Zol or whatever Dlamini Zuma wants to put out there. But we always hear about, let's say, for example, going a bit off topic, I think, but about these decolonization efforts, right? But then when the lockdown started, it was as if we took a European solution and applied it to an African country. And like you pointed out, it wouldn't have worked very well in the first place to begin with because of your informal settlements, right? There's very little to almost no flowing water. There might be one communal toilet for, let's say, 20 or even more houses, right? And then you've got these shacks basically against one another with a 10 meter by 10 meter little lot that's allocated to these people. So you don't really have that sort of control as maybe, let's say, somewhere in New Zealand, right? Where that might not be as prevalent as it is here in South Africa, right? So you can actually say that economic disparity sort of also contributes to communal cohesiveness in a sense. And I think that's what we're witnessing in a lot of other more well-off countries, right? Except maybe the US, but that's debatable. But yeah,
Well, I think what's interesting is that, you know, if you look at New Zealand, it is basically a social justice warrior utopia, in the sense that that sense of cohesion that Johann is talking about is deep. Um, there was never really a situation where across racial lines people were against each other, and the amount of charity that New Zealand does, the amount of social services that it provides, I think goes a long way to plugging up that social cohesion. But I think in South Africa, you've got this villainization of the very people that make social justice possible, right? So if you look at the villainization of white people, and basically anybody who could be considered bourgeois, you know, anybody that falls in the sliding scale tax bracket, whether it's a business or a corporation or a taxpayer, you know, there's this feeling that everybody that's doing okay is on one side, everybody that's not doing okay is on the other side, and I think everybody is just sort of frustrated with the other party. The grantees seem to think that when the ANC installs a tap, that they should be thanked, when in fact it's the taxpayer that should be thanked. I think that gratitude is misplaced, and those who could possibly contribute more than just their tax base are getting a bit hurtful. You know, we know what happened in Zimbabwe, and I think this brings up an interesting question for me around immigration. Is that you can almost see immigration, or you could see immigration as a political tool. So if you see what happened in Zimbabwe collapsed. Now it's collapsed. And at least to some degree, they're looking back at that whole episode and saying, geez, maybe we didn't do the right thing there. That didn't really work out the way that we thought it was going to work. And there's this idea, I certainly have it, that you could use immigration as a political tool. Basically, you retreat to a safe distance and you say, well, this is the South Africa that you wanted. We're not in it anymore. How's that working out for you? And then perhaps you're in a place to, you know, negotiate a settled return, if we can put it that way. I'm wondering, Johann, does that sort of scenario creep up in the back of your mind? Do you think maybe you'll go to New Zealand and you'll always sort of be looking here and see how it goes? Maybe we're appreciated again.
Yeah, it's difficult to say. You know, I think you know, looking back, you know, one of the reasons also that is quite nice in New Zealand is that, you know, once you're there for long enough, you're also entitled to a state pension, which is quite a large amount of money that you get from the government there as retirement benefits. You know, that's on top of your kind of own top-ups of that. And that, for me, you know, does create a it's definitely something that kind of inspires you to stay there in the long term. Because if you do end up coming back, you know, the sort of retirement savings you need to start putting together then in a shorter time to equal the amount of money you would be getting from government there, you know, that makes it, you know, it makes you think twice about possibly coming back. And for me personally, you know, this is a fairly permanent move, you know, because also if you had to come back, you know, you're sort of sitting in a situation as a white male looking for a senior management position. It's not something that's easy to find anymore, you know. It's a tough work environment out there. BEE, it definitely has an effect on employability. So for me, that is a problem. If I ever wanted to come back, I'm going to be an old white male looking for work, and it can be problematic to find something like that. So I'm not sure for me personally that it might be something like that. I think, and also, having now gone through the process, packing up your life, all of that, it's quite a big process, so perhaps it's just a mental thing, but I'm definitely not going there to have a look and see when I can come back. For me, it's a fairly permanent move, for a number of reasons, and I don't unfortunately think that I'm going to be looking back and saying in 5 years' time, no, I think things are looking a bit better, let me come back. It's really a permanent thing. I think, there was at a stage where there were a lot of South Africans that immigrated that were coming back, sort of 2007, 8, thereabouts, because we managed that whole 2008 housing collapse in the US. We managed quite well in South Africa, so we were relatively in good shape. And I think a lot of people at that stage were kind of coming back. And then we entered the Jacob Zuma era, which then unfortunately was not particularly good for the country. But at this stage, I think it would take a lot of guts to say, listen, in 5 years' time, I think I'm going to come back. Because it's really takes a lot of work, a lot of effort, a lot of mind shift to make the move. And for me, I don't think it's a question of sitting there and watching. And unfortunately, I think it is a bit of a political statement, because I think a lot of taxpayers in this country, I think it's one of the few countries in the world, probably the only one in the world, where the majority of taxpayers didn't vote for the government that's spending their taxes. Mm-hmm. And, I think that what the government might not necessarily realize is the fact that every immigrant that leaves takes their taxes with them. So your tax base is slowly eroding, and especially when it comes to healthcare practitioners, you can't replace a healthcare practitioner. If they leave with their taxes, it's not like in another corporate where somebody on a lower level then gets promoted and somebody gets promoted, and in the end your tax loss is kind of at the bottom level almost. But it's not as big an effect with healthcare practitioners that leave the country. They don't get replaced. So besides the services that they were rendering that are now missing, it's also their taxes don't get replaced. And that's a big thing. And I mean, if you look at the kind of top tax bracket in South Africa, it doesn't have a lot of people in there. You've got about 200,000 people in that top tax bracket that pays 67% of the personal income taxes. Mm. You can imagine if 20,000 of them leave, what it does to your tax income on a government level. And, looking at the figures, that is about what is leaving at the moment. And mostly the people that are leaving are sort of in your top 2 or 3 tax brackets, because unfortunately it costs a bit of money to leave the country. So you find that your tax base slowly gets smaller and smaller, and it gets eroded. And fewer people need to keep paying the taxes that keep everything else afloat. And unfortunately, the government policies do not currently look like they're going to be having the radical change that's required to turn the economy around and get it going again. We keep doing the same thing and expecting different results almost. Mm. And you've got, and then you've got to throw in something like the fee protests with the students. I mean, there's a huge sense of entitlement that people are saying, listen, I'm entitled to have my tertiary studies funded for free. That's like an expectation now. And that's very concerning, because and when it boils right down to it, it's a terrible investment, because even, historically, it's always been, that about 20% of first years actually end up making it and getting their degrees. So if you're funding 100% of first years for their studies, only 20% of that actually turns into a graduate. The rest is money you're basically chucking down the drain. So I think the students themselves are quite happy to have that, because now suddenly they've got housing, they've got food, they can study and whatnot, for as long as that lasts. And then you find that they don't pass, and then what? Now they want the historical debt written off so they can carry on. But it's not a good investment. And somebody, a market analyst, said it the other day, that that is not it's not a good way to spend money from a social point of view, because a degree is very much to the benefit of the individual that gets the degree, and not towards the society that is paying for him to get that degree. And that's unfortunately now a problem that was created. Now it's there. We're not going to get rid of this ever again. But it's not a good investment of money.
It's actually quite an interesting point. I need to actually remember that. But something that I've read, and I think it was I think I told Siv this in the past. It was from St. John Chrysostom that said that welfare is based on two things: gratitude and willingness. Right? So it has to be the willing giving action of an individual to another individual. And that other individual has to display a form of gratitude, right? And you've pointed something out very, very interesting with this whole fees movement thing, the entitlement aspect. And he also warned against that. He said that if the king, or the government in this case, were to send the soldiers to confiscate all the wealth of the people that had wealth, to redistribute it to the poor people, it would become a thing of entitlement for the poor and resentment from the rich to the poor. And I think that's what we're seeing currently as well, which would again push that drive for immigration, right? Because the people are starting to resent the system that they are in, because they feel like they have, first of all, they have no say. Taxation, regardless of the tax bracket, whether you're in the lower tax bracket or at the highest tax bracket, it's involuntary. Right? You don't have a say in how much tax you want to pay and what kind of programs you want to support. So already there, it's just entitlement from the establishment to take what they perceive as rightfully theirs. And you did not willingly agree to that. This is what we're seeing now, in corruption, and especially the Zondo Commission. You see that the politicians, they just have this idea of, well, I'm entitled to it because apartheid, or because whatever reason you can think of, right? And then also your economic policies. I'm glad you touched on that. One of the economic policies, like you pointed out, broad-based Black economic empowerment, is, at least in my view of things, an extreme barrier to the economic growth of this country. I know some people might disagree with that, but they have to prove the contrary, because currently what we're seeing is the exact result of that, right?
And I think the biggest concern there is that it's not actually broad-based. Had it been broad-based, you might find that it would have worked better. But the fact is, you've got a small political elite that's busy getting rich off broad-based Black economic empowerment. So it's actually narrow. It's quite narrow-based economic empowerment, actually.
Well, it's broad-based for their finances, for these elite political...
It's incredibly broad.
So in that sense, you can't argue against the broad-based Black economic empowerment. But what's surprising for me is it's this mentality that I think, like you pointed out, this sense of entitlement. And I think this is the main driving force, right, behind immigration. I might be wrong, but this is what I can see so far.
Yeah, and I think, if one looks, for instance, at something like healthcare at the moment, there's an expectation that was created by the ANC at their 2007 conference, and 2010 they came out of an NHI green paper, and that created that sense of entitlement of free healthcare for all, without having to pay for it. But the fact is, somebody's got to pay for it, and the policy uncertainty around NHI at the moment is actually causing a lot of healthcare professionals to leave the country, because, as the policy stands at the moment, we're 10 years down the line, there's still nothing written in there that tells a healthcare professional, if I render services to a patient outside of a hospital environment, how am I going to get paid for these services? Things like that are just missing from the policy at the moment. And that uncertainty is causing healthcare professionals to leave this country in droves. And it's quite a sad thing, because they're very difficult to replace. If one had to look at figures, for instance, last year, we had 30 psychiatrists leaving the country. Now it sounds like, 30 psychiatrists, it's not a big problem. It's 5% of the psychiatrists in the country, 30 psychiatrists.
Wow.
So we had 5% of the country's psychiatrists immigrating last year. So those are the kind of figures that are quite scary if you look at them. And, we've had the Minister of Health at some stage saying, but, then they must immigrate because, why are they immigrating to the UK where they've got an NHS system that is doing exactly what we want NHI to do, And it's like, well, when you get to the UK, you know exactly what you're getting paid. You know when you're getting paid, you know who's paying you, and you know what's expected of you from a treatment point of view. So you've got certainty, and if you add to that the sort of socioeconomic certainty that you get by going there, suddenly it's quite appealing. Whereas locally, we're trying to implement a policy that we still haven't shown us how we can afford it. And frankly, we can't afford it, but we're not willing to admit that because it's a very nice political tool. Every election time, there's a bit of an uptick in NHI rhetoric because it's what the voters want to hear. So you find that, we've got this dogmatic approach to NHI policy, because for the sake of it, and practicality has gone out the door a long time ago, and we need to make a policy shift in healthcare from saying, how are we going to implement NHI to how are we going to achieve universal health coverage? Because the whole NHI concept of a single payer tax funded model is simply not going to work. But if you say, listen, let's get universal health coverage, how do we get public patients to access private healthcare services? If you start having that conversation, private healthcare professionals will get on board very, very quickly by saying, listen, I'm going to donate some of my time. I don't need to get paid for it. An hour a day, I'll see state patients. You organize a way to get them to me. I'll see them. I'll treat them free of charge. And you'll get to that point, and people will be willing to do that, private healthcare practitioners, but we're not having those conversations. We're having a conversation about how do we make NHI happen. And as much as those opponents of NHI are saying, it's not going to achieve universal health coverage, government comes and goes around and says, or they say, listen, we don't want NHI. Then government says, oh, but you're against universal health coverage. It's not. That's one model of achieving it, but that's not, people are not opposed to universal health coverage. They're opposed to this particular model because it doesn't make any sense in the South African setup. But we're not willing to make that mind shift to say, right, so what does make sense? What can we practically achieve that is not going to cost us an arm and a leg? How do we make that work? But we're not having those conversations, unfortunately. And the uncertainty around that is making healthcare professionals very, very skittish. So, it just takes one kind of botched hijacking or somebody breaking into your car or something, and that's the straw that breaks the camel's back. And then people are saying, listen, I don't know what my job future is looking like. Now I've been subjected to crime. I don't think I'm in the mood for this anymore, and our healthcare professionals are very well trained here. We've got a very good training system going, and everybody, Canada, UK, US, all of those countries gratefully accept the South African healthcare professionals because we're very well trained. So it's a sad state of affairs, and I think it's that ideological approach to policy that is so problem causing in South Africa.
All right. So in conclusion, what I can then draw from this entire conversation is economic uncertainty, socio uncertainty, and then high crime rates. Basically, the lack of security is what causes people to immigrate. So do you have any closing thoughts on this?
Well, I do have a bit of maybe a tricky question if Johann has time for one more question. But taking into account everything we've discussed, right, the argument maybe against immigration, if SA collapses, which, let's be frank, it seems like it's going to, then those who are rich enough to be villainized, right? So those who still pay tax, etc. They're basically non-grantees and non-BE elites. Basically, they will become the targets. So if you have this max exodus from South Africa, you sort of leaving behind a whole swath of people. And I've heard a counter argument against immigration, which basically says that we have a duty to stay, to basically prolong what seems to be inevitable, to try to stave it off, give everybody a chance to try and get out, or maybe even everybody stays and, I don't know, we politicize the 18 million people that didn't vote in the last election that could, certain solutions like that. I was wondering, does that cross your mind at all? Does that weigh on you?
Look, yeah, it is unfortunate because I really feel bad for the people that are staying behind and have that view to an extent. And what's interesting is 10 years ago when people told other people, listen, I'm emigrating, people were like saying, oh, but you're going to miss the sunshine and the braaiing and your family and that. Nowadays, I haven't had anybody saying that to me. Everybody said, we understand. So I think there's a definite kind of shift in people starting to kind of realize that we are in a bit of trouble here. And yes, there is a viewpoint that if we stay behind, we can fix things. But my concern is that competence does not thrive in South Africa, unless you've got some radical political changes to stop cadre deployment. If you start deploying people because they're competent to do a job instead of that they're a loyal party member, if you can take care of the corruption, if you can just get things moving along. I mean, if you look at the kind of municipalities where private citizens have taken over sort of the water supply situation and things like that in the Northwest, where they fixed the water supply within 4 days of taking it over, when the municipality have failed for 12 months because the municipal councillors were getting kickbacks for the renting of the water trucks that were coming to supply the communities. So if we genuinely had a situation where the civil service started caring about the services that they delivered, and where politicians started making decisions based on what is right for the citizens and not having a kind of a different, doing something because they see a way for themselves to make money out of it. If we had that sort of situation going where competent people could be employed to do the work, and could genuinely change things, I think I would have considered staying. But unfortunately, at this stage, it doesn't look like we're there, and it doesn't look like we're going to get there anytime soon. So I'm a little, perhaps I'm just very pessimistic, but I don't see 15 years from now that things are going to be the same as they are now, and I don't think they're going to be better as they are now. And for me, I'm now making the choice to say, listen, I'm now going to look after myself. And perhaps it's that sense of community that's not there. But I don't feel like the community is necessarily looking after me as a person, and I'm going to look after myself now. So it's an unfortunate situation, and I'm afraid that there's a lot of people that feel like that at the moment, because it's almost a sense of hopelessness. It's people are really trying. You've got people trying hard to try and change things, and it's simply not making the difference that they want to make. So I think Adrian Gore is an example of a very positive person in South Africa that's trying quite hard to make a difference. And as much as, there's one of him, there's 10 guys that are trying equally as hard and not managing to make a difference, and the question is how much perseverance you have in the long run to carry on trying to make a difference, and in the meantime, you get beaten down by policy, you get beaten down by a lot of different things. And eventually, if you don't have a raving success with whatever you're trying, it really becomes difficult, So, I think that's the problem, and you get that community that's trying gets smaller and smaller, and they need to work harder and harder at trying, which is then equally more tiring for them. So yes, it does create a bit of a difficulty, I think, and I don't know what the solution is. I think there needs to be some radical changes in order for us to get to a point where people can look at it and say, listen, I'm going to try to make a difference because it's actually possible to make a difference. And I'm not sure that we're at that point of things, unfortunately.
I think on that note, our sponsor for tonight's interview should probably be the ANC's NHI policy.
I think the ANC policy as a whole should be the sponsor for all immigrants.
Yeah, precisely. But on that somber note, and on that very insightful end to this interview, I just want to thank you again, Johann, for shedding some light and actually showing us, because I think there's a lot of people that didn't quite understand the reasons behind why people would immigrate. Years back, for example, I would probably have been one of those people. Right? I would see people leave the country and I would be like, but why? You're a coward, you're running away. It's only years later that I started to look at the situation of South Africa, and I started to think, maybe there's more to it than just my opinion of it. And I think your interview and the way that you answer our questions certainly highlights a lot of the things that we've been thinking about. And let's just try and keep the radical changes away from the ANC, because right now it'll probably be the acceleration of expropriation, NHI, and the increase of the wage bill, despite what they say in the news. And yeah, again, thank you very much.
Or perhaps having the EFF doing the radical change.
Oh,
exactly.
That's kind of the radical change we don't need.
Yeah.
But, I think in closing from my side, I think it's important for people to realize that when people immigrate, it's a massively tough choice. It's not just something that you wake up in the morning and decide, right, I'm now fed up and I'm going to go. There's a lot of processes that lead up to it. It's incredibly hard. You are leaving behind your entire life. You're leaving behind your family. You're going into the unknown, and you have to, it does speak of people being desperate for a better situation, almost, that you're willing to give up what you have in certainty at the moment. Yeah, as much as you can have certainty, is that you're giving that up for an uncertain future, but a future that you believe is a positive future. But it's tough. You leave behind a lot of things. You basically have to become a citizen of a different country. Your normal culture you've got to kind of put that on ice and adopt a new culture if you want to fit in. Otherwise, also, you start picking up problems. So I think it's a very hard choice that people make. And I think one must realize that, anybody that immigrates, it takes a lot of sleepless nights to get to that point, and a lot of, tying off loose ends and making, it's a radical life change that you make, and I think one has to have a bit of empathy. If somebody feels that you need to do all of that to make a better future for yourself and your children. And it's, and that is what it is. I don't think it's a question of I know in the late 90s there was a lot of people that went for a gap year. They went to the UK and they went to have a jolt, and they came back. At this stage, when people are leaving, it's quite a serious thing, and it's quite a permanent thing most of the time now. And I think a lot of people, like I've heard now, is that they say, look, they understand, and it's kind of sad that so many people are saying, listen, they understand why you are leaving the country you were born in and living in your whole life for something else. It says something about society on our side if people start saying that and no longer trying to convince you to stay, because they kind of realize deep down that probably you're making the smart choice. So, but it's tough. It's not an easy thing. And yeah, that's kind of my closing thought is just to and I mean I on my side, I've got sympathy for everybody staying behind, because I'm leaving behind my parents, my brother and sister, they're staying behind, and they're not getting out of here, so their lives are not necessarily going to improve like mine might on that side. And I feel sorry about that, but it's beyond my control, unfortunately.
Yeah, I think that's something that we've realized as the years went on, and we actually started to weigh these questions. Siv, any closing thoughts on your side?
Yeah, just to say that I really enjoyed the conversation, and I think in my darker moments, I definitely have this sense of apathy and desperation, which is, I think, something that this conversation rather reignited for me, and I'm sort of wondering how much is that ticket to Australia.
Look, perhaps in your case, you might want to consider something like, maybe Malta or Ibiza or something like that. I think something of a little bit more personal freedom might be the way to go.
Yeah. So,
yeah, I definitely don't want to end up in Victoria or something.
Oh, guys,
Yeah.
thank you again so much. Boys and girls, you've been listening to Begging the Question, and our guest once again is Dr. Johann Serfontein. I will drop his social links in the secret descriptions down below. Please subscribe and share our podcast. And again, join us for the next one. Cheers.